Hello, I'm Maz from BizVision, and today we're here with Sally Stuart from Link Business, and we'll be discussing medical practices and just buying and getting into medical practices. And we thought the best person for this is someone who has experience and has been in this field for more than a decade. So I'll let Sally do the introduction herself and just tell us more about herself, and then we'll talk about medical practices and biomedical practices in Australia. Hello, Sally.
Fantastic.
Thank you.
Hey, thanks for joining me. Thanks for inviting me. It's lovely to talk to everybody. So I have been working with medical doctors since 2004, so 19 years. I've been supporting doctors for the first 10 years from a recruitment perspective. I brought a lot of internationally trained doctors from overseas into Australia. So I started with junior doctors. I was supporting then after that senior doctors. Then I did locum GPs and permanent GPs within Australia. So I have been supporting doctors from a recruitment perspective initially, and then that developed into the pathway I am on now, which is selling practices for doctors. So I heard people tell me, Sally, we don't want just another locum. We want a locum with a view to that person taking over our practice. I heard that 3 times in 2 months, and I thought, wow, there must be a niche here that's not being filled. So I did all the registration and training that I needed to be a business broker, and I'm a specialist business broker in the health space. I've been doing that now for 9 years, and I only support doctors, dentists, allied health, aged care, and NDIS business owners. I refer to myself as a dream facilitator. So if the dream for the doctor is to buy a practice, I help them. If it's to sell a practice, I help them as well. So hopefully I can help some of your connections to be able to achieve their dreams as well.
That's great. Being in this industry for close to a decade, I think there'll be a lot of valuable input from you for our clients.
So yeah, thank you. Let's hope so. Happy to help.
Yeah. If you don't mind, we start off with just having an overview of the health industry and medical practice sales process. If you could just shed some light on that area.
Certainly. So we have a lot of businesses coming to the market at the moment. It's a generational change. So we're seeing a lot of baby boomers that have been practicing for maybe 45 years, some of them 50 years, and they are now looking to retire. So we're seeing a lot of retiring doctors bringing their business to market so that they can relax a little bit. We are also seeing people that have been burnt out with COVID. So for 3 years, they effectively had a pretty tough time. A lot of them have gone, that's it. I love medicine, I love my patients, but I can't do practice management and ownership anymore. A lot of doctors go into medicine to help their patients to regain health, but then they end up being stuck in a business ownership or entrepreneurial type position, which they realize that they don't like especially after a pandemic. So there's a lot of fatigued doctors out there, and what we're doing is seeing a lot of those transition into the hands of new and fresh business owners and younger doctors. So we're seeing a lot of change at the moment. So as a business broker, I follow a few steps when I'm bringing businesses to market to make sure that they're presented in the most professional manner possible for the vendor and the easiest way for the buyer to understand. So I will collect all of the details about the practice, such as the leases, DA approvals, so council approvals. We would look at the financials for the last 3 years. We look at the year-to-date financials. We look at the billings of all the clinicians as well as the billings of the practice owner. I will do the normalization and work out the real profit of the practice, because a lot of doctors don't have any business training. And if I can't show them very clearly how profitable the practice is, they might not realize what a great opportunity I'm showing them. So I try and break it right down so that I can understand it. If I can understand it, then I think a doctor can understand it. I'm not accountant trained, but I am trained as a business broker and real estate agent. So long as I can get it to the level where doctors can understand it, then you can talk to your trusted advisors as well and get their support. Once you understand how much profit is in the business, then we would talk about the sales price as a profit multiple of that business, and or a percentage of the actual income into the business. So I will showcase the business, and then if you're interested, we'll get you to have a chat online with the business owner, perhaps after work or on a weekend. We can do that online no matter where you are in the world. If and when you come to Australia, we can certainly get you to the clinic. Again, business hours may be off limits because of confidentiality. We would like to take you through the clinic either after hours or on the weekend, introduce you to the business owners, and then you can see the clinic.
Okay, great. Sorry, yeah.
So that's what I was going to say. Once people have decided that they want to buy a practice, we will also help them with their lawyer, with their accountant. We will help you to create the offer, which might be a heads of agreement. We would do this before the lawyers get involved to save the buyers money, because if I can help, they don't pay for my services, but as soon as they get lawyers involved, that's when the fees start accruing. So we would help you with the sales and purchase agreement. We would help you and your accountant to undertake the due diligence. We would help you with transferring the 10% deposit at contract signing and exchange, and then your lawyers will help you with the final settlement, which is when the 90% remaining is due and payable, and that goes to the vendor.
Okay, that's great. That's a very good offering. You did mention that after you find out the profitability of the medical practice or the business, then you show the doctors how profitable they are. And I know each industry they different. So like there's specifics to a particular industry. Are there any specifics or requirements or the way that the sales process or just acquiring a medical practice different to other businesses? And also, you mentioned multiples. Just as a rough guide for, I know each business is different, but a rough guide of how evaluation of a medical practice is done. How is that different to
Sure. So just to clarify, I'm not a valuer, I'm a business broker. So I will provide a complimentary market appraisal of the business. This will take into consideration comparable sales that I have made in this industry using our software. So we've got proprietary software that we use in Link Business. No one else has this software. We're the largest global brokerage, and I'm a specialist in this space. So I can only talk about selling health businesses. So what's different about the health business might be, for example, that doctors can only practice in a clinic with ARPA registration. So until a doctor has ARPA registration, they can buy a business, but they can't practice in it. If you have ARPA registration and you do intend to work in the clinic that you buy, then you are eligible for up to 100% financing from the banks. Permanent residency, I believe, is viewed as the same as citizenship with regards to getting funding by the bankers. So when we're talking about profit multiples, it depends on what the practice is doing. So if it's only relying on the government for funding support, we would call that a bulk billing clinic, and their profit multiples are lower because it is dependent on changes from the government, which we're seeing roll through at the moment. They've just, with the most recent budget, so from the 1st of July, there will be increases into the profitability of GP practices. With a bulk billing practice, it might be 2.5 to 3 times the profitability. In a mixed billing clinic, so that's some bulk billing and some private billing, it might be 3 to 3.5 times the profitability becomes the sales price. Now, what that means is that clinic should pay the business owner back in 3 to 3.5 years. They will start making money from that business. If it's a dental practice, for example, it might be 4 times the profit multiple. So yes, each industry is slightly different. I hope that answers your question in terms of what's specific to a GP practice. You don't need to be a doctor to buy a practice. You don't need to work in the clinic that you buy. If it's able to be run remotely, happy days, and that might mean it's a higher profit multiple, for example. If it's got a larger number of doctors, it might be a higher profit multiple. If it's highly profitable because it's all private billing, then it might be between 3.5 to 4 times profit multiple. If it's a group of clinics, it might be 5 to 6 times. So there's all sorts of different weighting factors that impact on the profit multiple.
And what do you think has been the biggest challenge for buyers of medical practice in this space? What has been the biggest challenge from your point of view for a buyer, for a potential buyer?
The unsurety of, just in the last few years, the unsurety of what's going to happen with the pandemic. It's a once-in-a-lifetime pandemic. People didn't know how much longer they were going to have to be paying, for example, huge amounts of money to protect them and their staff with the PPE, the gowns, the masks, the eye covers, etc. So that caused a spike in the costs. There was a whole lot of government funding. They didn't know when that was going to run out. They didn't know how much longer that they would be having to have restricted services. For example, dentists, they were closed completely apart from emergency cases. So medical centres had no people in their waiting room. So they've had to change the way that they've provided services. They've had to pivot. They've had to think outside the box. They've gone to telemedicine and telehealth. So we've had a huge amount of uncertainty in the last few years. We're coming out of that now, thankfully. And then what's happening in about 6 weeks is there's a new budget. So we've got a different pot of money that's going to be focused, and a huge amount of money will be tipped into the GP space, which means that practice owners from the 1st of July will be looking to get, in some of them, triple the amount of incentives that they had prior to the budget changes. So the WIPs, now we call WIPs our workforce incentive payments, they are being tripled, and there's additional payments for the item 23s. There's additional payments for the elderly pensioners. So there's a huge amount of money that's being invested. Here's my notes. So the budget 2023, GPs are now being valued and funded with longer consults and telehealth, the tripling in the bulk billing incentive for vulnerable patients. There's a 30% increase in the WIPs, which is the workforce incentive payments, and that's for your nurses and your allied health staff. And the indexing of Medicare from the 1st of July is up by 3.6%. So in terms of the positives for GP practice, I think our current budget will deliver and make it a lot more attractive once again to be a GP clinic buyer and owner.
And especially more if I can recall correctly from what you said, if the practice is mostly bulk billing, I think it will affect them more.
The impact will be greater.
Yeah. Okay.
Yeah.
Now, you did mention about the workforce incentive, and some of the buyers, they could be that they at a different stage in the business visa journey. Some of them are licensed to practice in Australia, and some have limited registration, or they're not registered yet. For them to know which areas they could go into, if I recall correctly, there was a tool that you used. If you're able to provide a bit of example of how they could use that tool for them to know which area they could go into if they are licensed, or if they're looking at getting licensed, which areas they're more likely that they could buy a practice and practice in their own clinic as well.
Certainly. So I'm sure that you'll be including this on the transcription and the translation.
Yep.
But if you can perhaps write down, and I'll pop it on my screen. So if you can write down health.gov.au/resources, and I'll pop that link somewhere so that everyone can click onto there.
Yeah, we'll add the link to the file. So
please click on distribution priority area and modified Monash model for 2019. Type in the address that you want to have a look at. So let's say, for example, we might have some people interested in Brisbane. let's say a northern suburb of Brisbane might be Bridgeman Downs. So you type in the address and then you can see whether it is suitable for an overseas trained doctor to get a Medicare provider number to work in that clinic. If it says distribution priority area no, which is DPA no, it means it is not suitable for an overseas trained doctor to get a Medicare provider number to work in that clinic. If it says yes, then they can.
Okay. Sally, are you able to share your screen and just the same example that you use with the actual tool open, so they can see the tool as well?
Sure. So this is a tool that doctors can use to see whether they can get a Medicare provider number to work in the suburb that they're interested in. So up here you can see, you can select it for specialists. So we can have a look and see whether specialist anaesthetists, radiologists, OBGYN, oncology doctors, cardiologists, surgeons, ophthalmologists or psychiatrists can work in a particular clinic. So for example, I'm just going to untick all of these and then we will have a look at psychiatry in the suburb of Penrith, which is a western suburb of Sydney. And then we can see that here's our code down here. So yes is yellow, blue is no. We can see that Penrith is suitable for an overseas trained psychiatrist to get a Medicare provider number granted to be able to bill patients through Medicare in this location. If, for example, they wanted to work right in the centre of Sydney, let's see whether that is suitable. Whoops, Sydney, and then it says no. So it's not an option to work right in the city centre, but out here in Penrith, you can certainly get a provider number to be able to bill your patients through Medicare.
And if one day they do want to set up a clinic or practice in Sydney, just curious to see what is the pathway for them?
So sure. So overseas trained doctors are restricted from the Health Act. So there are two restrictions. So the first one we refer to as 19AB. This is a 10-year moratorium. And this used to be District of Workforce Shortage. Now we call it DPA, which is the Distribution Priority Area. They need to work, if they're working as a GP, if they're working in a regional and remote location for the first 10 years. After that, they can work in metro, Sydney, Melbourne, Brisbane, wherever they like, Gold Coast. If they work in a very, very remote location, they can knock this over in 5 years. And then there is a scaling discount. So the more you come closer to a city, then the smaller the discount. So you might be able to knock out your 10 years in 5 years or 7 years or 6 years or 8 years. Most people do it in 10 years because they don't want to take their families to an undesirable location to live and work for 5 years. It is tough. But yeah, once you've done your 10 years, and it doesn't have to be all in the one location, you can move all around the country, get a feel of where you want to live and settle. And then those 10 years go towards reducing, that time period reduces your 10 years. And then eventually in the fullness of time, you can work in the city.
Okay, great. Now, I know that some of our listeners, they wanted to be asking this question, that they are a specialist. The same applies for them as a specialist, now an orthopedic specialist from overseas coming to Australia to practice. Does that apply for specialists as well?
So let's have a look. So let's select all of these. Only if your speciality is listed here, this is my understanding, then it's subject to DPA or DWS, District of Workforce Shortage. If it's not on that list of 8 specialities, there are no restrictions and you can work wherever you can get a Medicare provider number granted. However, there are other restrictions. So we call it the area of need, which is AON, area of need. dictates that unless there is a requirement for overseas trained doctors to come and work, then you won't get a Medicare provider number granted, even if it's not a DWS location. So there are various levels of restriction, DWS and area of need. Area of need is usually in a regional location, so you probably won't be able to come into the centre of Sydney and get a Medicare provider number granted because it's not an area of need. So we might say that somewhere on the coast, north or south of Sydney, might be an area of need, but not the metros.
Okay.
So you've got area of need and DWS, and then there's another restriction, which we refer to as 19AA of the Health Act. Now, this refers for GPs if they have got permanent residency or citizenship of Australia, but they're not yet a fellow of their college, then they have to work in a 3GA training program. Now, this means they need to be working towards getting their fellowship with either the RACGP, which is the Royal Australian College of General Practitioners, or the Australian College of Rural and Remote Medicine, which is ACRM. So there are different specialisations, and once you've got your fellowship with them, if you are a citizen or a permanent resident of Australia, then you are no longer restricted by 19AA of the Health Act, but you might still have 19AB restrictions until you finish your 10-year moratorium. So you might start with one or both, and then post-fellowship, you might have one remaining, or you might be eligible for a spousal exemption or an education exemption. So if you're teaching doctors in a university, you might be eligible to get rid of that those final years in your 10-year moratorium. So there are some workarounds, but it's very highly legislated, and you need to have a specialist working with you that knows and understands immigration, registration. We can introduce you to all of those people. We can help you. We can support you along the whole journey. So it's just one step at a time. Each step, we've got people to support you.
Okay, great. Thank you, Sally. I think this will be very useful in terms of the legal requirements for practitioners from overseas, practice in Australia, and also when they're considering of buying your practice, these are definitely important factors that they need to take into consideration. And it is highly regulated industry as well. Now, we've talked about, deciding on the location based on legal requirements. Are there any other considerations for someone who's going to be looking into buying a medical practice, or what qualities should they be looking for in a medical practice?
You want to make sure that your clinic is accredited. I think it's important to be owning and operating a clinic that is running according to the current guidelines. Not only that, you're going to get workforce incentive payments, which are your WIPs. If you have allied health and nurses, you're going to get PIPs, which are practice incentive payments. So I've got a one doctor clinic I'm selling at the moment. Their additional government funding is $100,000 per annum, just because they're maintaining their accreditation. So it's important to get your accreditation and to keep it. Clinics are accredited every 3 years. So this is an ongoing audit procedure to make sure that the clinic is run in the way that will maintain your accreditation, and which will ensure that your incentives continue to flow in every quarter. You want to make sure that you've got car parking. So one of the biggest things to come out of some of the online summits that I've run for the last 4 years is car parking is so essential to a practice. Now, depending on which council, which location you're looking at buying your clinic in, each council has different regulations with regards to car parking. Some will require 3 car parks for every consulting room and each full-time equivalent GP that is eligible to work there. So always ask about the car parking and the council restrictions on the number of doctors that can work in a clinic. There might be restrictions on the hours that the clinic can be open. So for example, I'm selling a clinic at the moment, which would actually be fantastic for an overseas trained doctor to buy, because it's an after-hours medical deputising as a GP. If you've got 19AA restrictions and 19AB AB restrictions. This is a Sydney clinic. You're half an hour away from the CBD, but unfortunately the sales price is too low for the visas. So I think that there are options to buy multiple clinics to achieve the visa and the 888, in which case this one would be ideal. But this one has got opening hours from 9 in the morning or 8:30 in the morning, I think, till 10 o'clock at night. And that's 7 days a week because it's in a shopping centre. So one of the other things you need to talk about is what hours can you work? I mean, you might not want to work all those hours, but it's nice to have the option to work all the hours that you can, because the number one way to increase the profitability of a clinic is to fully utilize your consulting rooms. And if the clinic is not open, then you're not utilizing your rooms. However, another clinic that I'm selling down to the south near Wollongong, they don't come in on a Saturday. The owner has got a new baby, so he stays at home and he does telemedicine. So that's another way. You can't utilize your rooms, but because we've learned how to pivot during COVID, then there are flexible ways that you can help with bringing money into the practice and not even actually using the rooms. So this means that you can have multiple clinicians that are still billing from one medical centre, but physically not being constrained by the size of the rooms. So it's almost like now we have rubber walls because there's flexibility in working remotely and away from the office.
That's quite interesting. I'm sure some would probably be asking right now, based on those restrictions, they probably want to ask is that if they have a medical practice, for example, I can see on the map in Gosford, and they only take teleconsultations and telehealth, and they're in Sydney, would anything stop them from practicing in that way? So setting up or buying a medical practice in Gosford area, which I can see it says for psychiatry, for example, in this case is yes, but they're located in Castle Hill, which is obviously in the blue section, and they can't practice there. So would they be able to just provide their service over the phone and have their medical practice in Gosford, but
yes,
be physically somewhere else? So meaning
the short answer
that
is yes.
100%, yeah. So 100% of the clients could or patients could be online.
So what we're seeing, I was talking to a psychiatrist last night actually, and he said what he's trying to encourage psychologists and psychiatrists to come back into the workplace because the human connection is so important with mental health patients. And as much as some of them might struggle to leave their own homes to get to a clinic, he said what we're seeing now is a hybrid with some online medicine and some in-person medicine being offered.
Okay.
Best of both worlds.
But for someone who has a medical practice, there's no legal requirement for them to be physically there all the time?
No.
Or even 20%? Okay. So I think this will be a good takeaway in terms of.
And I was actually
what
selling a clinic. I was selling a business that had everything set up for business owners to have a 100% online practice, but you still need to have registered doctors to provide that service.
Okay. So I think that this will be interesting for those clients that are bound to buy a business or relocate to a regional area in terms of where the business is taking place. So it's the ongoing concern of the business is in a regional area, but they could be living elsewhere. Now, you did mention about a practice that you had that it was online. It would be interesting to see what are the current offerings that you're working on. You think it would be interesting for clients, and also using them as an example of what to look for in a medical clinic. I think that will be very useful.
Yeah, sure. So I have got about, I don't know, about 30 practices that I'm working on at the moment. I can just quickly share that screen with you as well. So you can see here, I've got a full range of clinics for sale. I do operate all across Australia. I've got some that are coming to settlement within the next 6 weeks, being the end of the financial year. I've got clinics, I've got day surgeries, I've got specialist gastroenterology and psychiatry businesses. I've got physio businesses supporting aged care residents, so all sorts of practices there. So I'll just stop sharing that, and then let's talk about a few of them that I think would be great for people overseas. Let me just stop sharing that. And I've got clinics, like I said, in all states. I do sell clinics on the Gold Coast, in Brisbane. I have got Melbourne. I have got Sydney, Western Australia, South Australia sometimes. But for an overseas trained doctor, I think it's important to think about how they're going to run this. So we really need to have multiple doctors remaining, or you need to have options where they don't have to be able to be, where they don't have ARPA registration. So for example, I have a clinic here in Sydney, in Castle Hill. We saw that on the map earlier. It's a desirable location. Lots of doctors live in the Hills District. The block sizes are large. It's high socioeconomic suburbs. This clinic treats patients that have got chronic pain. They've had a lifetime of pain, some of them. They're looking for alternatives. So when we think of pain management, if it's, for example, myself, I've had ongoing back and neck pain for most of my life. And my go-to person is a chiropractor. Some people don't like chiropractors, they go to physios. But this is the third option, and it's low-level laser treatment. So this can be provided by a doctor or a physio or a chiro or a nurse. Actually, it could be provided by you or me, but we may not give the greatest efficacy. But this business will teach the new business owner how to provide this therapy to all the patients. They've got a huge patient base. They can't provide enough clinician time to the patient base that they have. So the business owner, she's looking to retire. She's been working in this field for the last 30 years. She's happy to train the incoming owner on how to use this therapy. And I believe it's in a price point that would be attractive to a 188 business user to get permanent residency in Australia. It is Sydney and it's 500,000. I've got another one which is more expensive. It's an 8-doctor practice. It's also in Sydney. It's 1.5 million. So it is a lot more expensive, but the only person that's leaving this clinic is the practice manager. She's the owner. So potentially someone doesn't have to have ARPA registration to buy this clinic because they don't need to work in it. We've already got 8 doctors that are working in it. If they've got practice management experience, fantastic. Or they're happy to learn as well and be trained in it, that could also take place. Other opportunities we've got in Melbourne. Melbourne, I believe, has a lower financial cost to buy a business in Melbourne. So we do have other clinics in Melbourne with doctors remaining. On the Gold Coast, I've got business and building for sale. In Brisbane, I've got a GP clinic on the north side with patient-based remaining. So yeah, and it depends at this point in time. If I've got 27 built businesses for sale, in 6 weeks' time, I'll have sold 6 of them and potentially got another new listing, another 6 new listings. So it's constantly changing. When your buyers are ready to buy, what I've got now may or may not be available. So there's always businesses transacting.
Okay, great. So these were very good examples. I think we've taken enough of your time, and so I think it was very helpful. I also learned a lot in terms of a lot of restrictions that they have to face as a medical practitioner from overseas. But it's quite interesting now that they could take all that into consideration, and they could even my takeaway was like they could set up a practice in a regional area, and they're not required to be there physically to run that practice as their own clinic. And also the laser treatment for pain management was an interesting idea, that they don't need to be registered as a
that's right.
and to deliver that sort of stuff.
So long as the buyer has a good understanding of human anatomy. But the beauty about this business is it could be franchised, it could be licensed. Now, the vision of this business owner, her vision for this is to be licensed in every GP clinic in Australia, because every GP clinic sees patients with pain problems. So in GP clinics, we have subleases with pathology. We have subleases sometimes with allied health. So it might be physio, it might be hearing, it might be psychology or counselling. But this is just another option for a GP clinic owner to get an additional income stream through having the rent to a pain therapist using low-level laser therapy. So that's her dream and vision, and she's happy to teach doctors all across Australia how to use the lasers. The lasers are not as expensive as they used to be, and now they are in a size where you can put them in an overhead compartment on a plane. So they're mobile, and they do have approval to be taken into residential aged care facilities so that you can treat the elderly residents with their ongoing pain as well.
Okay, that's great. Now, there were a lot of guidelines and a lot of tips and tricks in terms of buying a medical practice, and we've discussed the sales process of a medical practice. 100% sure there's a lot more to it to get a favorable term, or get a favorable condition in the sales process, which will negotiations, which will probably require a bit more time and experience to do that. But I think this was a good starting point to let the clients or even us to know what we don't know and how to ask the right questions. But then finding those answers, they would probably need help in that process.
So I am paid by the business owner, so I can't have a transaction for the business owner without a buyer. So I'm here to help both parties. There's no charge for my time from the buying side, and the transaction pays my fee. So I'm here to help both sides. I'm here to give information and to share openly my knowledge so that I can give confidence to buyers that they know that they are dealing with someone that they can trust. I'm also a Justice of the Peace in New South Wales and Queensland, so I can't lie. I promise to always tell you the truth. And I think that's important for buyers to know who they can and can't trust, because they don't know, a lot of the times they don't know who they can put their trust in. So it's important to know who you're dealing with. But certainly I think dealing with doctors for 19 years has given me that credibility to be able to support other doctors moving forwards, and certainly that's what I hope to be able to do for you.
Okay, great. Thank you, Sally. Thank you for your time. And for our listeners and people who might be watching this, the translation of it, how do people reach out to you?
Sure. So I don't have a screen I can pull down. I guess I do. I'm on LinkedIn, so connect with me on LinkedIn. I'm on, here's my profile page, here's my numbers in Australia, +61 437 082045. Here's my email address, so it's sally.stewart@linkbusiness.com.au. But you can find me on LinkedIn as well. Here I am.
Okay, great. I think we'll also add this to the notes as well, so people can reach out. Especially, I probably will be assuming there'll be a lot of doctors asking a lot of questions based on your experience and even recruitment. But from my experience, Sally's been very approachable. She's very knowledgeable, and she's been very helpful in this process. And so I do thank you again for your time and taking time out of your busy schedule to have this chat with us.
It's a pleasure. I'm pleased to help you.
Thank you very much. Thank you.
Thanks.